Hello, my name is Dr. Diwan S. Raja. Today I will discuss about cocaine. Cocaine is a popular drug of abuse derived from coca plant. Coca plants grows in the Latin American countries. It may be sniffed, smoked, or injected intravenously. Occasionally, it is combined with heroin and injected as speedball. It is also called liquid lady when cocaine is taken along with alcohol. Cocaine may be adulterated by lidocaine. This is another anesthesia, local anesthesia, methamphetamine, ephedrine, caffeine, and PCP, phencyclidine. Crack. What is crack? Crack is the potent, purified, smokable form of cocaine. Cocaine has numerous street names and number is huge. We have only few here like Barney, Scary, Cecil, Coke, Dust, Green Gold, Snowflake, Pimp's Drug, Jet, Stardust, White Girl, like that. A lot of other names. These are the synonyms used by the substance abusers. So what is the mechanism of action of the cocaine? How it works? Cocaine, it is in one way local anesthetic that is approved by FDA. Cocaine has also potent pharmacological effect on the other side on dopamine, norepinephrine, and serotonin in the central nervous system. These are neurotransmitters. These are catecholamines. Cocaine is a central nervous system stimulant and inhibits the reuptake of catecholamine. That means this will not be reuptaken in the presynaptic membrane. There will be generalized sympathetic stimulation due to action of the cocaine. Okay. We go to the pharmacokinetics. Cocaine is well absorbed from all routes. It may be taken as a smoke. It may be taken in the nose as a snorkel, or it may be taken orally. It may be taken intravenously. Okay. Smoking and intravenous injection produces maximum effect within 2 minutes. Oral and mucosal absorption, if it is taken orally, may take up to 20 to 30 minutes. So if it is snorting or it is smoking, then it will produce maximum effect within 2 minutes. Okay. Half-life of cocaine is about 60 minutes. Coca-ethylene has longer half-life. Coca-ethylene, if a person take cocaine, simultaneously he also take alcohol, then a condition is called coca-ethylene that actually increases the half-life of cocaine. Toxic dose is highly variable, depends on the individual tolerance, physique of the individual, age of the individual, route of administration, and presence of other drugs. Ingestion of 1 gram or more cocaine is likely to be fatal. Okay. What are the signs, symptoms? Cocaine acts on all the systems. It affects the CNS, central nervous system, affects the cardiovascular system, affects the pulmonary system, kidney system, Obstetric complication is also possible. Psychiatric manifestation is also possible. The central nervous system, initially it causes euphoria. Euphoria means sense of sense of happiness, followed by anxiety, agitation, delirium, psychosis, tremor, muscle rigidity, convulsion, seizure, coma, and hyperthermia. So temperature will go up. There will be hypertension, blood pressure will go up. And intracranial hemorrhage, because of high blood pressure, the small blood vessel in the brain may be ruptured, and those blood vessels may have some congenital defect or just due to high pressure that may break the blood vessel wall, and that may lead to cerebrovascular accident or intracranial hemorrhage. It may be subarachnoid hemorrhage is also possible, maybe intracerebral hemorrhage. Chronic use leads to insomnia, lack of sleep, weight loss, and paranoid psychosis. A washed out syndrome. What is washed out syndrome? After a binge cocaine intake, some people or a significant number of people go through profound lethargy and sleep, and that sleep continued for several days, even a few weeks. Then the person will come back to normal. This is called washout syndrome. What are the cardiovascular manifestation? Sympathetic activity, how can I say it? There will be pupillary dilatation, there will be tachycardia, increased heart rate, there will be sweating. These are the features of sympathetic overactivity. There will be vasoconstriction. Okay, ventricular tachycardia, fibrillation, severe hypertension that may lead to stroke or cerebrovascular accident, coronary artery disease, myocardial infarction, stroke. Okay, what are the pulmonary manifestation? We may have chronic bronchitis, and we have pneumonitis, pneumonia. Renal manifestation is possible due to there may be hyperthermia, there may be breakdown of muscle, myoglobin that may go to the kidney and that may damage the kidney. Obstetric complication, there may be premature delivery of the baby, there may be abruptio of placenta may be separate out prematurely. So those are the obstetric complications. Psychiatric manifestation, person may develop agitation, person may develop psychosis. This is a term called body packers or stuffers cocaine. A smuggler, these people may be caught in the airport, maybe in the seaport. A smuggler may swallow large number of tightly filled cocaine-filled condoms like this. He intentionally swallowed that. Idea is that it will come out through his anus when he'll go to the safe place. Similarly, street vendors swallow cocaine stuffed condoms to avoid sudden raid of police. Okay, what is the problem? Condom, the person may not tie the condom nicely. Condom may be open, or it is too stuffed, so it may open anyway. Then a large amount of cocaine will be the intestine that will be absorbed via the portal circulation, that will be distributed throughout the body. Okay, so this may be the source of death to the smuggler or to the street vendor. This may be broken, it may not be tightly closed, it's one end, so it may be spilled in the abdomen that may lead to catastrophic effect. Okay, cocaine condom may rupture and release massive amount of cocaine. So what is the cause of death in our patient? It may be cardiac arrhythmia. Person may die cardiac arrhythmia most commonly. Okay, maybe due to cerebrovascular accident, okay, or ventricular fibrillation is the cause of death in a person who abuse cocaine as a substance abuse. Okay, diagnosis is based on history, sympathetic overactivity like heart rate up, blood pressure going up, pupil dilated, and a lot of sweating. Those are the sympathetic activity. There will be skin mark because people inject themselves, so there may be skin mark. Okay, skin mark is also shown. Nasal septal perforation, very common. Those who snort especially those who snort the cocaine to the nose. ECG is very important. It should be continuously monitored because patient may die due to ventricular fibrillation or heart failure. Blood urea nitrogen, it is also essential due to this drug intoxication. There will be excessive myoglobin will be released that may block the renal tubule. So we may have renal failure and we may have high blood urea nitrogen. Creatine phosphokinase, it manifests the muscle damage. This person develop rhabdomyolysis. Person may develop myocarditis. So we'll get this enzyme to be counted, how much it is. CT head, okay, especially in the children, we may have suspects hydrocephalus. In adult is also possible to do the head, the CT head, okay. So we got skin mark, ECG, blood nitrogen, CPK. CT head is important to find out any intracranial hemorrhage. Abdominal X-ray is essential if you suspect some smuggler took the cocaine container or condom containing cocaine that has been in the abdomen or in the stomach. We must do the X-ray. Sometimes X-ray may not find it out. We may go to the CT scan. Treatment, immediate emergency room visit is essential. It is not to stay home and get treatment. Rather, patient should go to the hospital immediately. Should be treated by licensed physician in a hospital setting. Airway, breathing, circulation should be maintained. So the patient should breathe in, out. Okay, nothing should block his or her mouth or nose. Okay, so that is breathing. And look at the circulation, pulse volume. No specific antidote for the cocaine treatment. There is no specific antidote, but we need to decontaminate. If we come in contact with the cocaine patient, then we can decontaminate the stomach of a person who took the cocaine by activated charcoal or by gastric lavage. If these two fail on rare occasion, surgeon open the abdomen to find out the gauze or the condom packet or something inside the abdomen. So we may need surgery like laparotomy to get out of those products like the condom that may not come in the stool, may not come in the X-ray. And that's all about the toxicity of cocaine. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice day. Bye now.